I'm Dr. Ananta Bhushan Ranade. I'm a medical oncologist by profession. And today I'm going to discuss with you one of the most difficult to treat cancers, that is pancreatic cancer. Now, what is pancreas? Everyone knows that pancreas is an organ situated deep inside the so called stomach or the abdominal cavity near the spine. It is behind the stomach, or what we in vernacular call as jadhar. Behind the stomach, there is an area between the stomach and liver where the pancreas is situated. What does it do? Well, pancreas has a very important function in the body, control of blood sugars. So everyone knows that, everyone knows what diabetes is. But today we are going to talk about pancreatic cancers. Now, if you look at 100 sufferers or patients of pancreatic cancer, 90 to 95% of them are what are called as exocrine tumors or exocrine gland tumors, and the remaining are endocrine, neuroendocrine tumors. Let us talk about the common entity first. What are the signs and symptoms which a patient presents with, or what should I be worried about if I am going to be looking forward to thinking whether I have pancreatic cancer? It's very simple. These are the symptoms. The first and foremost important symptom is severe pain just behind the chest in the abdominal cavity. If one has severe pain, one should start thinking about whether it is related with pancreas. The patient may like to sit in a crouched position and may get relief in that position. Then it could be some pathology related to the pancreas. For any patient, if there is sudden onset loss of sugar control or a newly diagnosed diabetes with very severe sugars, one should start thinking about pancreas, and is it pancreas that is affected? Another very common symptom is getting jaundice. Now, why? Pancreas is one organ, liver is another. But remember, what happens is pancreas is situated just very close to the liver, and any tumor of the pancreas can compress the bile duct. The bile duct is a duct which collects the bile and drains it to the intestine. Now, if that is obstructed, obviously the bile doesn't get flown off and it gets collected, and then we can see that as jaundice. Another symptom which comes with pancreatic cancer is lack of appetite. The patient just doesn't feel like eating, and the patient may feel hungry at times but doesn't feel like eating. Now, this is a very paradoxical statement, but that is how patients tell us that I feel like eating, I know I should eat, but I can't eat. So, anorexia, weight loss, which obviously follows because of less eating, these are the symptoms of pancreatic cancer, apart from pain and symptoms related to the hormonal secretion. Whenever a person says that he or she has pancreatic cancer, generally it is supposed to be the exocrine tumor or the exocrine cancer of pancreas. The neuroendocrine tumors of pancreas are a very different entity, they're treated differently. So let's not get into those cancers right away. Now, what are the causes? Whenever we hear about the symptoms, we obviously want to know what are the causes of pancreatic cancer. The exact cause of pancreatic cancer, or a very clear-cut cause, is not that well known, but definitely smoking is implicated as a cause of pancreatic cancer. Obviously, if you consider two groups, the groups in which smokers are there has more number of pancreatic cancers, and if you consider all pancreatic cancers, around 25% of them are smokers. Second cause is age. Higher the age, more are the chances of pancreatic cancer. Third is obviously some kind of an inflammation of the pancreas called as pancreatitis. Now, pancreatitis could be there because of multiple reasons, but one of the most common causes of pancreatitis is alcoholism or alcohol consumption. Now, why is this cause important? Because this is something that we can prevent, and whatever we can prevent for a cancer, we must try and prevent. So, alcoholism or alcohol consumption, along with sudden onset changes in the hormonal levels, also should be taken as causes for pancreatic cancers, or I would say at times because of the cancer, these things become very apparent. Let us get this very clarified. Is it the tumor which is giving rise to insulinoma, what is called as, or a tumor of the insulin secreting cells, which is giving rise to insulin and causing problems in the body? Or is it because of the insulin that is being secreted there is a cancer? No. The tumor itself will start releasing these hormones and then cause these symptoms. So in pancreatic cancer, as we saw, the symptoms could be because of actually having a tumor at that site. The second group of symptoms could be because of obstruction of the biliary tree, which drains off the entire bile from our body. And the third cause is something to do with hormones and alcohol consumption, etc. So once we have an idea as to how pancreatic cancer can start or can have symptoms, we must be very vigilant, because pancreatic cancers are one of the few cancers which can get completely cured only in first couple of stages. When the cancer becomes big, it is very difficult to treat it, and if it spreads, it's even more difficult to control it. Unfortunately, your healthcare workers or your doctors are not able to palpate or feel the pancreas because it is deep inside the body. So, a general examination in early stages will not tell us anything about pancreatic cancer. So, if you have symptoms, we have to diagnose them, or we have to take you through all the various tests, the radiological tests, the pathological tests, so that we can come to a conclusion of whether the person has pancreatic cancer or not. If the cancer in pancreas is very small, it should be operated upon. If a surgery is possible, that is the best option for the patient to live. Unfortunately, the place where pancreas is situated is very odd. So, getting a small tumor in the head of pancreas is very difficult. Sometimes a very small tumor can get diagnosed because it compresses directly on the bile duct or the common bile duct. Now, at that stage, even a small tumor of 3 to 5 mm can be diagnosed, and then it is treated, and the cure rates are fantastic. But otherwise, because the gland is situated in such a situation that whenever there is obstruction, the tumor is already big, and it is difficult to treat such tumors. If surgery cannot be performed upfront, nowadays we do try and see whether the tumor can be reduced in size, whether we can get good margins. Now, here I must talk about margins. What are margins? See, whenever we try and operate a tumor, we don't go too close to the tumor and try to shave it off from the structures that are adherent to it or that it is adherent to. So, what do we try? We try a rim of normal tissue around that particular tumor to be intact and remove all that. What I mean is, if the tumor is of a size of a table tennis ball or a ping pong ball, we try and remove a tennis ball sized tissue all around the tumor so that the malignant cells are not there on the border or on the cut margins of that particular sample or the specimen. The distance between the cut margin and the margin of the tumor is called as surgical margin. And in any kind of tumors, it is best to have negative surgical margins, meaning thereby there should be no tumor on the resected margins. Now, having said that, it is not possible every time that you get some kind of margins. So, in such patients, we try other type of therapies first, upfront, and once we are successful, then if we can downstage the tumor, then we operate on it later. Unfortunately, when the tumor goes from place A to various other places in the body, we say that the tumor has gone into fourth stage. And at that stage, it is very difficult to deal with pancreatic cancer, and we have to be really, really very cautious. And multiple other complications start because of that. For example, when the tumor is big, it starts abetting the bile duct, and the patient starts getting jaundice. Once the patient is jaundiced, the patient doesn't feel like eating. The body resources go down. He feels or he starts feeling weak, so on and so forth, and a vicious circle begins. So it is extremely important that we diagnose any cancer, especially pancreatic cancer, at an early stage so that we can attempt a cure. Now, as I said, we do talk about something called as exocrine tumors of pancreas, and the commonest cancer in that is called as adenocarcinoma, in which actually the tumors of the duct and the gland itself start getting converted into malignant cells, and they are treated or dealt with in the standard treatment protocols of surgery, chemotherapy, and radiation. Nowadays, we are having extremely good results with immunotherapy for pancreatic cancers, and in some cases also targeted therapy. So the horizons of success are expanding, but at the same time, we cannot forget that early diagnosis is the key to a successful treatment of pancreatic cancer. The remaining 7 to 8% of pancreatic cancers are called as neuroendocrine tumor. And those are the tumors which originate from the hormone secreting cells. So they are called as either insulinomas or some other kind of tumors. Now these tumors require an entirely different treatment. They are also at times called as stromal tumors, etc. Their treatment differs. Everything is different. So please don't equate that this particular person had pancreatic cancer and this one also had pancreatic cancer, but their futures are going to be the same. No, they are not going to be the same. They are in fact going to be different. So we have to bear all these things in mind while we do such comparisons. Very often, unfortunately, today what happens is when something unfortunate happens with a patient, the relatives tend to blame the doctors that, oh, that particular pancreatic patient did well, pancreatic cancer patient did well, but this particular patient with pancreatic cancer did not. So there must be something wrong with the doctors. No, it is not as such. The tumors are different, individuals are different, and treatments are different, and their fates also are different. So let us remember this and try and make sure that we treat pancreatic cancer nicely, diagnose it early. Thank you.